Gloves on. All right, my scene is safe. Sir, are you okay? Are you okay, sir? What's wrong?
I was attacked by a dog.
All right, so he's alert, and mechanism of injury is a dog attack. I need backup. Patient is not in need of a C-spine. All right, I'm now gonna check his airway. All right, it seems to be clear. All right, now I'm gonna check his breathing. All right, patient's breathing is sturdy and rapid. I'm gonna put him on some oxygen. All right, sir, I'm gonna get your pulse now. His pulse is 110, and his skin is pale, cool, and clammy. I'm gonna check him now for any major bleeding. All right, the patient has got lacerations to both his left and right arms. I'm gonna apply direct pressure to his left arm laceration. And then I'm gonna apply gauze to hold it in place. All right, I'm now gonna apply pressure to the laceration on his right arm. And then I'm gonna apply bandage to hold that in place. I'm gonna treat my patient for shock, and I'm gonna move him into the supine position. All right, patient is high priority in need of rapid transport. All right, I'm now gonna get the patient's respiratory rate, pulse, and blood pressure. All right, patient's blood pressure is 135/90. His respiratory is 30 and weak, and his pulse is 110. All right, sir, so when did the pain start?
It was after I was attacked by a dog.
All right, sir, can you describe the pain for me?
It feels like if you put your arm through a wood chipper.
All right, so sir, where is the pain located at?
I can feel it in both my arms, my face, and my chest.
Sir, what makes the pain better or worse?
Not moving makes it better.
All right, sir, on a scale of 1 to 10, can you rate your pain for me, please?
I'd say about an 8.
All right, sir, how long ago were you attacked?
10 minutes ago.
All right, so signs and symptoms of my patient are that he's got lacerations to both his left and right arm, and then he's got abrasions to his face and chest. All right, sir, do you have any allergies I need to know about?
I'm allergic to bees and peanut butter.
All right, sir, have you had any past medication?
Flintstone gummies, and I'm on Ozempic.
All right, sir, do you have any past medical history I should know about?
Eating disorder, stroke, heart attack, diabetes, blood clots, depression, cancer, asthma, arthritis, cerebral palsy. I think that's it.
All right, sir, can you tell me the last thing you ate?
15 honey buns and half a pack of Cheez-Its.
All right, sir, what were you doing before all this happened?
Well...
So I had just finished my honey buns, right? I was walking down the street, eating a bag of Cheez-Its, when suddenly my neighbor's dog ran from her and knocked me over. I think it was trying to get to the Cheez-Its and the peanut butter and cucumber sandwich in my pocket.
Aren't you allergic to peanut butter?
Yeah, I am.
All right, whatever.
Anyways.
It attacked me and then ran off with my sandwich.
All right, so I'm gonna check my patient's eyes, ears, nose, and other facial areas. All right, so everything seems to be in order except for his cheek, which has a slight abrasion, which I'm gonna put a dressing on and then wrap and bandage it. All right, so I'm gonna check my patient's neck area, see if anything's wrong. All right, so his trachea is in the right position and his jugular veins are fine. All right, so I'm gonna check my patient's chest for any injuries. All right, so there is severe abrasions to the chest area. I'm gonna apply a sterile gauze pad and I'm gonna bandage it. All right, I'm now gonna check my patient's abdomen and pelvic region. All right, there seems to be nothing wrong with the patient's abdomen or pelvic areas. All right, so now I'm gonna check my patient's lower extremity, starting off with his left leg. I'm now gonna check my patient's right leg. All right, his leg seems to be unharmed. Circulatory and motor functions are all fine. All right, now I'm gonna check my patient's upper extremity, starting with the left arm. All right, now I'm gonna move on to the patient's right arm. Patient seems to have lacerations to the forearms of both arms, and motor functions for both arms seem to be impaired, but the circulation is fine. All right, I'm now gonna check my patient's posterior thorax, his lumbar, and his buttocks. All right, my patient's posterior thorax, lumbar, and buttocks all seem to be fine. All right, so I'm gonna recheck my patient's vitals every 5 minutes, and once the EMTs arrive, I'm gonna give them my full report.
My gloves are on, my scene is safe. Ma'am, are you okay? What happened?
I fell off the swing set.
Mechanism of injury seems to be blunt force trauma, and my patient is alert. Calling for backup. Patient is in need of C-spine. What seems to be the problem?
I fell off the swing. My ankle and back hurts really bad.
I'm now going to check the patient's airway. Airway is clear. I'm now going to check my patient's breathing. Breathing is 20 and strong. I am now going to check the patient's circulation. Pulse is 120 and rapid. Skin is pale, cooling, clammy, and there are no signs of any major bleeding. I'm now going to treat the patient for shock. Patient is high priority and in need of rapid transport. I'm now going to check the patient's blood pressure, pulse, and respiratory rate. Blood pressure is 110/70. Pulse is 120 and rapid. Breathing is 20 and strong. What were you doing when this all started?
I was swinging on the swing set,
What makes the pain better or worse?
not moving.
Can you describe the pain for me?
It's a sharp needle-like pain.
Where does it hurt?
Ankle shooting up my leg and in my back.
On a scale of 1 to 10, how would you describe it?
9,
How long ago did it start?
10 minutes.
Signs and symptoms include swollen ankle and loss of motor function in legs. Do you have any allergies?
Dogs and cats.
Are you on any medications?
No.
Do you have any past medical problems?
I had a stroke 5 years ago.
What was the last thing you ate?
A strawberry Twinkie.
What events led up to this?
I was swinging on the swing set. I swung too high. I tried to jump off and I hurt my legs and my back.
I'm now going to check the patient's eyes, ears, mouth, nose, and other facial areas. All the facial areas seem to be fine, nothing's out of order. I'm now going to check the patient's neck. Trachea is in position and jugular veins are fine. I'm now going to check the patient's chest. Patient's chest seems to be unharmed. I'm now going to check the patient's abdomen and pelvic area. Patient's abdomen and pelvic area seems to be fine. I'm now going to check the patient's lower extremities, starting with the left leg. Patient's left leg has a swollen ankle. Circulatory functions are fine, although motor functions are heavily impaired. I'm now going to check the right leg. Right leg is unharmed. Circulatory functions are fine, although motor function is heavily impaired. I'm going to check the patient's upper extremities, starting with the right arm. Now I'm going to check the left arm. Both the patient's upper extremities are unharmed, and motor and circulatory functions are all right. I'm now going to check the patient's posterior thorax, lumbar, and buttocks. Patient's posterior thorax, the spine was broken, though patient is already in a C-spine. Lumbar is unharmed, and buttocks is unharmed. I'm going to check the patient's vitals every 5 minutes and give the EMTs a full report when they show up. My gloves are on and my scene is safe. All right, what do we have here? I would say the mechanism of injury seems to be an electrical shock. Calling for backup. Patient does not need a C-spine. Little boy, are you okay? Okay, so patient seems to react to verbal stimuli. All right, sir, so what has happened here?
So, I'm sitting there watching basketball, and I hear a large yelp. So I come to see what happened, and it seems like my boy was playing with the outlet like he usually does. I told my boy to stop playing with that outlet, but he doesn't want to listen. Seems to have gotten up and bit him, if you know what I mean.
I am now going to check the patient's airway. Airway is open and clear. I am now going to check the patient's breathing. Patient's breathing rate is 25, shallow and erratic. I'm going to put the patient on oxygen. I'm going to check the patient's circulation and for any major bleeding. Patient's pulse is 150, skin is pale, cool, and clammy, and there is no major bleeding. I'm going to treat the patient for shock. Patient is high priority and in need of rapid transport. I'm now going to check the patient's blood pressure, pulse, and respiratory rate. Blood pressure is 90/60. Respiratory rate is 25 and weak. And pulse is 150 and weak. For signs and symptoms, the patient's palm is severely burned. Does your son have any allergies?
He's allergic to the fish with shells and the cats.
Does your son take any medications?
His mom says he needs an inhaler, but I say real men breathe with their own lungs.
Does your son have any past medical problems?
He's got some tism in him, and he also has asthma.
What was the last thing your son ate?
The boy had a peanut butter and cucumber sandwich. That boy will down peanut butter and cucumber sandwiches. And he also had a fruit by the foot.
What was your son doing before all of this?
I made him dinner, and then when I go to watch the game, I hear a loud popping, and I yell at him to be quiet. And normally, he just gives me some sarcastic remark. This time I didn't hear nothing, so I went to check what happened, and he was lying there on the floor.
I'm going to check the patient's mouth, ears, eyes, nose, and other facial areas. Patient's head is fine. I'm going to check the patient's chest. Patient's chest is fine. I'm now going to check the patient's abdomen and pelvic area. Patient's abdomen and pelvic area is fine. I'm now going to check the patient's lower extremity, starting with the left leg. Now I'm going to check the patient's right leg. Both of the leg's circulatory functions are fine, although their motor function seems to be impaired. I am now going to check the patient's upper extremity, starting with the left arm. Both the left arm's circulatory and motor functions are fine. I am now going to check the patient's right arm. The patient's right palm seems to have an electrical burn. I'm going to put sterile dressing and I'm going to wrap it in a bandage. Motor function seems to be impaired and circulatory function seems to be fine. Patient's posterior thorax, lumbar, and buttocks all seem to be fine. I'm going to reassess the patient's vitals every 5 minutes and give the EMTs a full report when they show up.
A strawberry Twinkie?